All right, and after covering the ascending and descending tracks, motor and sensory are the ascending and the motor are the descending tracks, it's time to move on and cover other topics in this lecture. Let's start with this hemispheric specialization. Now, this idea of a person being right-handed, using his right hand in writing, for example, or left-handed, is based on the, according to genetic research, is due to it's a natural selection. So how did that happen? In persons who have their left hemisphere being the dominant, we call it dominant hemisphere, and this is in 85% of human beings. Their dominant hemisphere is the left hemisphere. And in those persons, what do we have? We have in the left hemisphere the language center and the writing center, okay, and the speech center. Having those on the left hemisphere makes that hemisphere a dominant hemisphere, and then those people, because the left hemisphere controls the motor of the right side of the human body, that's to say all the right side of the human body, including the hand. That's why they will be right-handed. In about maybe less than 15%, they will be left-handed, with their language and speech and writing center maybe on the right hemisphere. So this is just a few tips and hints about this hemispheric specialization. So this left hemisphere, in addition to the language and the writing, it will be responsible for the calculations and the computation and the logical reasoning. That's why some neuroanatomists, they call it the logical side, the left side. While like the math and all this stuff, they're going to be on that side. While the right side, they call it the creative side, because music and all those fun stuff, they will be the source of these. It will be on the right hemisphere. So it's the creative side. So as we can see here, the music and face recognition and spatial reasoning. Spatial reasoning is a very important topic. In the next few minutes, we're going to talk about it in details. But mainly, the right hemisphere will be responsible for most of that spatial reasoning. Okay, so this covers the hemispheric specialization. So moving forward, this just is the same about what we have been talking about, and moving here to this topic of attention and hemispatial neglect. What is this? There is, of course, as you have studied in the possibly in the first few lectures of the nervous system, the human brain is divided into lobes. So one of these lobes is the parietal lobe. And the parietal lobe, is part of it is called inferior parietal lobule. This inferior parietal lobule is the structure that's responsible for the hemispatial attention in each hemisphere. So what's that? What's the hemispatial attention? Now, even when I close my eyes, I have this attention that I know the right side of my body is right here and the left side of my body is right here. And even when I close my eye, I can tell you about the right, the stuff on my right side, right? And the stuff on my left side right in front of me. But this is in the normal person. But in some persons, we're having a problem in their inferior parietal lobule, whether due to stroke, for example, or due to infection or whatever reason, or trauma, head injury, whatever the reason. If they're having a problem, if they develop a problem to that inferior parietal lobule, then they will be having a problem in attention and being aware of that hemispatial neglect. Let's first tell how did that work first, and then I'm going to tell you about how the patients, those patients that are going to present, for example, to a doctor or to the clinic or whoever, the caretaker. So now, this part, if this circle, which is divided into white half and green half, just like assume that this circle is representing what I'm looking at, like what I'm looking at, like the visual field in front of me here, right? If you can divide it into right part and left part, right white part and left green part. So the right part in front of me here, this is just facing me, okay? So the right part in front of me here, this part, the right part, if this is a midline, this part on the right side is controlled by both my right hemisphere and my left hemisphere, this right half. While the left half here from the midline and up to here, right, or everywhere, like from here up to here, right, all this part is controlled by my right hemisphere. Which part of my right hemisphere? That's the inferior parietal lobule in my right hemisphere. Let's say this one more time. If I can divide, if I may divide my visual field in front of me with the midline, right? With the line here in the midline, okay? So this is the right part, this is the left part. This right part is controlled by the parietal lobule on my left hemisphere. Sorry, the right part is controlled by both, by the parietal lobule, inferior parietal lobule on both, on my right hemisphere and my left hemisphere, while this left part is controlled only by my right hemisphere. Good. This point is there. Now, if my left hemisphere, the inferior parietal lobule in my left hemisphere is got a stroke. It's not functioning anymore. So what will happen? Okay, then what will happen to my right visual field here, hemispatial field? What will happen to it? Nothing will happen to it. I will still be able to recognize it. Why? Because this right part, I can pay attention to it by my both hemispheres. So even if my left hemisphere is not working, still my right hemisphere is going to recognize it. Deal? Now, what about this left part? This left part is controlled only by my right hemisphere. To be very specific, by the inferior parietal lobule in my right hemisphere. Now, what will happen if I got a stroke to my right inferior parietal lobule in my right hemisphere? This left part, I will lose the hemispatial attention to this left part. I cannot be aware of it, right? I'm going to have this problem that I will ignore and neglect everything on this left part if I got a problem on my right hemisphere. I hope this point is clear now. Now let's move and see how the patient are gonna present. Like most of the patients that will come with the problem of the negligence, they are neglecting their left side. Okay, because as we said, the right side is covered by both hemispheres, so it's seldom that you get a patient with this. But most of the patients, they will come with a problem in their left side because it's covered only by the right hemisphere. So let's see the next point. So when a patient presents to the health caregiver or the clinician, so the clinician, when he starts to spot this problem, he will give him a test, just a test with a paper and a pencil. He will ask him, okay, do you see this watch, okay, in front of you, right? Like from like 12, 1, 2, 3, like up to 12 again, right? I would like you to draw it again here, okay? So what will happen? As you can see here, the patient will neglect and not pay attention to the left part of the clock here, of the watch. Okay, if you give him this house to just to copy this image and draw it again here, he will not pay attention, and he will neglect the left part, and this applies to everything right here. If you give him just like a paper with the line there and ask him what is the point of the midline in this the midpoint in this line, like where the middle point, he will put it more toward the right because he is ignoring or neglecting or not paying attention to this left side. This is a serious problem because those people, like this is gonna ruin their life. Starting from eating, you put a plate in front of them, they will eat half of it and they will leave the left part of it. Shaving, like if they are doing like everyday functions, when they want to shave, they will shave the right part and they will leave the left part. They will not pay attention to it, they will neglect it. If they are walking through a door, they are not paying attention, not to the surroundings, even to their own body. Like this left side, if he's going, he's not paying attention to the left side, to his own hand, to his own leg, right? He might hit in the wall, right, or in the door because he's not paying attention to this. This is a serious problem. It needs a clinical evaluation and treatment. Okay, but it's very interesting. Now next we have what we call prefrontal cortex. This here in this purple color, we can see this is the prefrontal cortex. It's responsible for the restraint, initiative, and order, right? And also for the judgment and foresight and perseverance, curiosity, spontaneity, and motivation, creativity, personality, abstract reasoning, planning, working memory. Every like those functions, which are important functions, are going to be performed by this prefrontal cortex. In the past, there was this experience because the prefrontal cortex is responsible for the judgment. They were thinking that if they do what you can call like lobectomy, if you go surgically and remove this prefrontal cortex from the criminals, this might affect their behavior, right, and make them like good guys or good people. There was this experience in the past. Okay, and finally, one interesting topic is this what we call the RAS or RAS. What's RAS? RAS is the reticular activating system. You can see it right here, represented in this red color. This is a reticular formation. What does it do? It does like very sophisticated functions. One of these functions, it plays a central role in states of consciousness like alertness and sleep. Unless our reticular formation stops sending signals to the hemispheres, to the cerebrum, you will not be able to sleep. At that particular time, when you go to bed, the reticular formation or the reticular activating system will stop sending signals to the cerebrum, right? And that will decrease our alertness, and that will lead us to sleep. So it plays that central role in sleep, in consciousness sleep. The second and that very interesting point, I like to read about it, about the reticular activating system, is it's a filter. I like when I call it what you think about, you bring about. It's a filter that brings the information that you want and you're thinking about to your consciousness. For example, if you decide to buy a car, let's say Honda Civic, okay, you just decide tomorrow I will go buy my Honda Civic, or maybe the day after tomorrow. Starting from this point of time and on, when you walk in the street, you will start to see like everybody around in the city, they got the same idea and they start buying this car. You will start to see a huge number of Honda Civic everywhere in every street, right? And you will be thinking like, what happened to people? Like everybody is buying it now. What happened is those vehicles, those cars were always there, but because you were not thinking about it, the reticular activating system was not allowing this information to come to your consciousness. They were just part of the overall picture around you. Now, since you start thinking about it, you will start seeing it everywhere. They will be pushed through the filter system of the reticular activating system. And this can help, like this point, the psychotherapist and the psychologist are saying that this is very important for the person if he want to set goals, like those people who have their motivation speech, right? They say if you have a goal, right, then you can use your reticular activating system to accomplish that goal. What you do, just write, like, for example, I would like to score really high in the ACB 310, okay? Then write it in a note, put it in, post it on your laptop, in your car, in your room, everywhere, okay, where you can see it. Even write it down in your cell phone. Then you will be seeing it everywhere. SCB 310, SCB 3, and I would like to score really high. And then your reticular activating system will bring to your attention every single possible way that you may excel and score high in this exam, okay? And then you will do it. You will do it, okay? So use your reticular activating system in your SCP 310 to score really high in it, and you are capable of doing that. You can do it.